The COVID-19 Cicada variant has been detected in 25 U.S. states. The World Health Organization is tracking it, and there's one mutation count that has scientists genuinely concerned. Here's what you need to know right now. Because unlike the usual COVID rumors flooding social media, this variant is real, it's spreading, and you need the facts. The COVID-19 Cicada variant, officially designated BA.3.2, contains a shocking 70 to 75 mutations. That's more than double what we've seen in recent variants. Scientists are calling this highly genetically divergent, and that technical term translates to one major concern: this variant might slip past your immune defenses. Right now, as you're watching this video, BA.3.2 is circulating in wastewater across 132 monitoring sites in at least 25 states, and the number keeps growing every week. But here's the most important question, and the reason you clicked on this video. Should you actually be worried about the Cicada variant? Let me walk you through what health experts are saying. First, let's establish the facts. This variant was first identified in South Africa back in November 2024. That's over a year ago. For months, it stayed mostly underground, quietly circulating without making headlines. That's exactly why scientists nicknamed it cicada. Just like periodical cicadas that stay hidden for years before emerging in massive numbers, BA.3.2 was spreading silently until suddenly it wasn't silent anymore. Since November 2024, this variant has been detected in at least 23 countries worldwide. In some locations, it now accounts for as much as 30% of all COVID cases. The first U.S. case was traced back to an international traveler who arrived in June 2024, months before scientists even knew this variant existed. By January 2025, the first confirmed U.S. case was officially reported, and according to the CDC's March 19 report, cases have been slowly but steadily increasing since then. Now, here's what makes this variant genuinely concerning to virologists. Those 70 to 75 mutations aren't randomly scattered. They're concentrated exactly where it matters most. These mutations are packed into the spike protein, the part of the virus that binds to your cells. That's the exact region your immune system needs to recognize to fight off infection. To put this in perspective, recent variants like JN.1 and LP.8.1 had about 30 to 40 spike protein mutations. BA.3.2 has roughly double that number. According to the CDC's official report, monitoring BA.3.2 provides valuable information about its potential to evade immunity from previous infection or vaccination. That's CDC speak for your body might not recognize this variant as easily, even if you've been vaccinated or previously infected. And that's the core concern. So where is the Cicada variant right now, and how fast is it actually spreading? Let me show you the current data. In Europe, BA.3.2 has spread more aggressively than in the United States. Several European countries are reporting it as a significant proportion of their total cases. In the U.S., as of March 14, 2026, the Cicada variant accounts for about 3.7% of wastewater samples collected. That might sound small, but here's the context you need. The current dominant variant in the U.S. is XFG at 53%, followed by LF.7.1 at 10.3%. But public health experts are watching Cicada's trajectory very closely. Dr. Robert Hopkins Jr., medical director of the National Foundation for Infectious Diseases, told USA Today, "It is possible we will see Cicada become the dominant strain in the U.S." However, he emphasized that's by no means certain. Variant dominance is unpredictable and depends on multiple factors, including transmission advantage and immune evasion capability. One major vulnerability Hopkins identified, low vaccination rates and little to no public health effort towards stopping COVID infections, leaves us vulnerable. There's also growing concern that BA.3.2 could potentially drive a summer surge in 2026. Summer travel and indoor air conditioning could accelerate transmission. Now, let's talk about what you're probably most concerned about, the symptoms. What does infection with the Cicada variant actually feel like? According to the CDC and frontline healthcare providers, symptoms appear similar to other recent COVID strains, and honestly, that's actually good news. Common symptoms include runny or stuffy nose, headache, fatigue, sneezing, sore throat, coughing, and changes in taste or smell. Some people have also reported gastrointestinal symptoms like nausea or diarrhea. These aren't new to COVID, but they're worth being aware of with BA.3.2 infections. But here's one symptom that's been particularly noted with cicada infections, a severely painful sore throat. Some people are calling it razorblade throat. If you develop an unusually painful sore throat along with fever, cough, or fatigue, that could indicate you're dealing with this particular variant. Get tested.
Now, the critical question everyone wants answered. Is the cicada variant more dangerous? Does it cause more severe disease, hospitalizations, or deaths? According to Dr. Hopkins, the answer so far appears to be no. He stated clearly, "I have not seen any data which indicates that cicada is any more severe than other circulating variants." Neil Maniar, director of the Master of Public Health program at Northeastern University, confirmed this assessment. Early evidence suggests the variant is not causing more severe illness. However, and this is important, Maniar noted it could pose added risks for vulnerable populations if it spreads more widely throughout the community. That includes elderly individuals, people who are immunocompromised, and those with underlying conditions like diabetes, heart disease, or chronic lung disease. So here's the bottom line on severity. Cicada doesn't appear to be a more dangerous version of COVID. It's a more transmissible version that can potentially evade immunity better. Which brings us to the question that affects millions of people. How well do current COVID vaccines work against BA.3.2? The current vaccine formulation was designed to target JN.1 and related Omicron descendants. Those updated vaccines came out in fall 2024. But BA.3.2, with its 70-plus mutations, is genetically quite different from JN.1, and that difference creates a vaccine effectiveness gap. Dr. Hopkins said it directly. The number of mutations from JN.1 viruses makes it less likely that current vaccines will be highly effective against cicada. Brandon Dione, a clinical professor at Northeastern University, echoed this concern. There's concern that the current vaccine is not going to be a great match. However, and this is absolutely crucial, research published in The Lancet shows that updated vaccines still provide meaningful protection against BA.3.2. The protection is weaker than against variants the vaccine was designed for, like XFG, but vaccines still significantly reduce your risk of severe illness and death. This is the same pattern we've seen throughout the pandemic. Vaccines might not prevent mild infection as well, but they keep you out of the hospital. So if you haven't gotten the updated COVID vaccine from fall 2024, this is an important time to consider it. Some protection is vastly better than none. Now let's talk about what this means for your daily life. Should you be changing your behavior because of the cicada variant? Neil Maniar put it simply, COVID is something that's part of our day-to-day lives now, similar to the flu and other respiratory illnesses. The focus, he says, should be on protecting higher-risk individuals and continuing standard precautions, not panic, not lockdowns, just sensible public health measures.
That includes basic measures we already know work: frequent hand washing, staying home when you're sick, masking in higher risk settings, and avoiding close contact with vulnerable individuals when you might be contagious. These aren't new recommendations, they're proven strategies. Maniar also warned, outbreaks can happen very quickly, especially as we move into warmer months and higher travel seasons. Summer 2026 requires vigilance. Brandon Dione emphasized there's no cause for panic right now. COVID has settled into a seasonal pattern similar to influenza.
The virus is generally manageable with vaccines and existing therapies like Paxlovid. We have the tools. We know how to use them. However, it's important to remember, COVID-19 still causes substantial illness and death. In the U.S., COVID is still linked to 300 to 500 deaths per week. That's far lower than earlier pandemic peaks, but it's still significant, comparable to a bad flu season running year-round. COVID hasn't disappeared. Dion's deeper concern is the possibility of the virus evolving toward more severe disease. That's the scenario that would stress healthcare systems again. But he acknowledged that risk remains low with BA 3.2 specifically. Current evidence doesn't suggest this variant is heading in a more dangerous direction. As Dion said, it's something we definitely want to monitor. It could become the dominant strain, but it's not yet there. So here's your practical action plan. What should you actually do with this information about the Cicada variant? Action step 1. If you haven't received the updated COVID vaccine from fall 2024, strongly consider getting it now. It's your best defense against severe illness. Even with reduced effectiveness against BA 3.2, vaccines still protect you from the outcomes that matter most: hospitalization and death. Action step 2, if you develop COVID symptoms, especially that severe razorblade sore throat along with fever or cough, get tested immediately. Home tests are widely available and affordable. If you test positive, antiviral treatments like Paxlovid are highly effective when started within the first 5 days. Action step 3, if you're in a high-risk group, talk to your doctor about additional precautions. This is especially important for vulnerable populations. This might include more frequent vaccination, avoiding crowded indoor spaces during surge periods, or having antiviral medications ready to start immediately. Action step 4, practice basic respiratory illness etiquette. Stay home when sick, wash hands frequently, cover coughs and sneezes. If you're visiting vulnerable people, elderly relatives, friends with health conditions, consider masking up. Small precautions protect the people you care about. Action step 5, stay informed through reliable sources. The CDC updates their COVID data tracker weekly. The WHO publishes regular variant reports. Don't rely on social media for COVID updates. Go directly to official health sources. They provide accurate, up-to-date information without the panic or misinformation. Now let's look ahead. What's likely to happen with the Cicada variant in the coming months? Right now, BA 3.2 accounts for just 3.7% of U.S. cases, but that percentage has been steadily climbing week over week. The pattern we're seeing in Europe, where Cicada has spread more widely, suggests it has competitive advantages that could drive U.S. dominance. But variant competition is inherently unpredictable. Sometimes a new variant takes over rapidly. Sometimes it plateaus or fades. We're watching in real time. What we know for certain, health officials are monitoring BA 3.2 closely. It's on the WHO's variant monitoring list. The CDC is tracking it across 25 states. And here's the reassuring part. We have the infrastructure to handle this. Vaccines, treatments, testing, and surveillance systems are all in place and functioning. We're not in March 2020 anymore. We understand this virus. We have medical countermeasures, and we have years of experience managing COVID as an endemic disease.
Bottom line, the cicada variant is real. It's spreading. Those 75 mutations are concerning, but it's not more severe. Vaccines still help, and we have the tools to manage this. Stay informed, not scared. Be prepared, not panicked. Now here's my question for you. Are you planning to get the updated vaccine if you haven't already? Or are you tired of COVID news altogether? Drop your honest answer below. No judgment either way. Hit that like button if this cleared things up, and subscribe for fact-based health updates. I'll see you in the next one.